everybody, my name is Carol Mack. This tutorial will discuss California and HIPAA rules for responding to patient requests to access medical records. Most states have specific rules for accessing patient records. The federal rule for accessing records is Section 164.524 of the Privacy Rule. California access laws are in the Health and Safety Code. Federal preemption invalidates state law if the law is contrary to HIPAA and both can't be followed. States may impose additional rules if the state law is more stringent than HIPAA. More stringent means the law provides greater access to PHI or affords better privacy protection. HIPAA has 5 basic guidelines for access. Subsection A has a list of exceptions where HIPAA doesn't apply. A patient has no right to access his or her psychotherapy notes. Information compiled for legal purposes cannot be accessed through HIPAA. Laboratory reports are governed by CLIA regulations. Patients may access lab tests only after the report is completed. HIPAA allows providers to suspend access to research data while clinical trials are ongoing. Providers may deny access to information that was revealed under a promise of confidentiality. California mental health law requires written evidence that confidentiality was promised. HIPAA subsection B establishes rules for timely action. Under HIPAA, providers have 30 days to respond to patient requests. California has a more stringent deadline of 5 days for inspection and 15 days for copies. HIPAA subsection C establishes guidelines for providing access. The privacy rule requires providers to accommodate requests for electronic PHI. Providers may impose a reasonable, cost-based fee to provide copies of records. California allows a maximum charge of 25 cents per page, plus clerical costs. A patient may designate a third party to receive copies of their PHI. California's Evidence Code allows attorneys to obtain medical records for their clients. HIPAA subsection D specifies rules for denying access. A provider's denial must be in writing and must inform the patient of their rights. HIPAA subsection E establishes guidelines for documentation. Entities must identify designated record sets and titles of persons responsible for processing requests. A designated record set means information that the provider uses for making decisions about patients. The designated record set does not include quality control data. Now we'll demonstrate how patients may access their records in Single Peak. Sister Agnes is the town's oldest resident. She lives in a retirement home for religious sisters. The sisters are learning to use electronic health records. They share everything, including their health information. Agnes is the expert on the computer, so the sisters have asked her to go to Dr. Pruitt's office to fetch copies of their records.
Hi, Agnes. How can I help you?
My sisters and I want to put all of our medical records on the computer.
That's a lot of information. Let me ask Dr. Hudson.
Hello, Sister Agnes. Let's go into the conference room and we'll figure out what you need.
As you know, the Sisters of Single Peak minister to sick and elderly. Well, last month, we almost lost Sister Olga. We had that picnic lunch and Olga got sick after she ate the peanut sauce. We didn't know she had a severe allergy to nuts. When Olga got out of the hospital, she went to the library to learn about personal health records. She came up with the idea of getting a PHR system. We were thinking we could put the app on the phone and on the computer.
You have a right to access your records electronically. We could provide electronic data from our computer. We don't charge for that, but most of your records are not electronic, and some of them are in deep storage. We should agree on the format for copying your records.
Could you scan everything into PDF format?
Yes, but that would be very time-consuming. HIPAA doesn't require us to scan paper records. But we could hire a computer guy to do it. He has a high-speed scanner. Oh, I think I see Guy. Yes, he's coming in the door right now. Let's ask him. Guy, we need an estimate for scanning thousands of pages of records.
You want me to copy Sister Agnes's chart?
Yes, and all the other sisters' records too. Do you charge by the page or by the minute?
It all depends on the job. The California Evidence Code allows an hourly rate for clerical costs. I charge $24 an hour for scanning court documents. For patient records, California has a limit of 25 cents per page for photocopying. But that rate might exceed the amount allowed by HIPAA. It depends on volume and the condition of the records. Show me the records and I can give you an estimate.
Okay, I'll ask Belle to get them ready for you. Okay, Sister Agnes, come back tomorrow and then we'll give you a quote.
Great, thanks. See you tomorrow.
Dr. Hudson, I have another question. Wilma needs her granddaughter's immunization records.
Her granddaughter's records? Where's Penny's mother?
Both of Penny's parents are in the military and they're stationed in Germany, so Penny is staying with her grandparents until the fall semester, and then she'll transfer to Heidelberg High School. The school requires immunization records. Could we fax those over to Germany?
Yes, that's fine. We can disclose proof of immunization for prospective students if the parent or the person acting as the parent requests the records. But you should ask Wilma for written instructions. You can use our form for sending records to third persons. Wilma should identify where the record should be sent.
Thanks. I'll call and ask Wilma to come in and fill out the paperwork.
The right to access PHI is significantly controlled by state law because California has shorter deadlines than HIPAA. On the other hand, HIPAA provides the right to access electronic records. Thanks for joining me in this tutorial. Now I want you to meet my colleagues, Roman Diaz, President of Touchtone Compliance, and Karen Darnall of Darnall Law Office.
We made these tutorials to help you learn about HIPAA and California law. For individual attention, go to our contact page. You can send us a message or schedule a consultation.
And I'm Roman Diaz, President of Touchtone Compliance. Our online tools and expert services provide everything you need to successfully address HIPAA compliance. We identify vulnerabilities, provide a thorough risk analysis, and assist with mitigation plans, policies and procedures, and staff training.